بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. I'm Dr. Hiba Kamil Khalifa, Assistant Professor of Forensic Medicine and Clinical Toxicology. Today we will discuss together a subject of drug dependence. It's a major toxicological subject and it is an important toxicological subject. Why? Because drug dependence not only a health problem, but there are many multiple problems related to it. Like what? Like social problems, like multiple injuries can be made under the effect of drugs, like crimes of sexual offenses, crime of motor vehicle accident, crimes of suicide and homicide, and lastly, our subject today, what is called physical dependence. Of this lecture, we are able to define physical dependence, know the criteria of drug dependence, the difference between drug dependence and habituation, types of addicts, how to diagnose a case of drug dependence, main lines of treatment of an addict, and lastly, we will take a look about common drugs of abuse. We are define some words. What is this word? We hear addicts or addiction, abuse, habituation, and dependence. What is the difference between these words? First, addiction. Addiction is to use the substance compulsively or uncontrollable without any control. We use substance without any control. Second word is abuse, to use the substance wrong or improperly. Habits. Habit is a constant, unconscious inclination to perform some act acquired through its frequent repetition. And lastly, dependence. What is the meaning of dependence, or what is the definition? Substance dependence or substance use disorder is a state of chronic toxicity produced by compulsive or repetitive use of the substance despite problems related to its use. Again, state of chronic toxicity produced by compulsive or repetitive use of substance despite problems related to its use. What is the criteria? What are the criteria for substance dependence? First criteria is tolerance. What is the meaning of tolerance? Tolerance is marked increase in amount or marked decrease in the effect. To obtain the first effect, we need to increase the amount of substance or decrease the space between the doses. So, tolerance, marked increase in amount or marked decrease in the effect if using the same amount. So we need to decrease the frequency between the doses. This leads to taking large amount for a longer period than intended. So second criteria is using the substance in larger amount and for longer period than intended. This make the patient or the drug dependent person make much time and activity to obtain, use, and recover from these substances. To spend much time and activity, so the person give up some important social, occupational, and recreational activities or reduce it. So, of this lecture, we are able to define physical dependence, know the criteria of drug dependence, the difference between drug dependence and habituation, types of addicts, how to diagnose a case of drug dependence, main lines of treatment of an addict, and lastly, we will take a look about common drugs of abuse. We can collect the criteria in the following: tolerance, much time to obtaining use and recovery, activities give up or reduce, unable to stop because of appearance of withdrawal. So the patient use the substance of dependence despite knowledge of health consequences. Okay, so we are talking about definition and criteria of drug dependence. What is the difference between drug dependence and habituation? Habituation is a repeated usage of drug or substance with the following character. It is a desire, just a desire, not a compulsion like drug dependence. It is a psychic dependence, not a physical dependence like substance use disorder. No tendency to increase dose in cases of habituation. And lastly, habit affecting a person only, not the society, but dependence affecting all the society. Okay, this is the major difference between drug dependence and habituation. What are the different types of addicts? Therapeutic or iatrogenic addicts, professional addicts, street addicts, and neonatal addicts. What is the difference between these types? Therapeutic or iatrogenic addicts is a patient taking the drug as a therapy and turn on to use it as a drug or substance of abuse. Professional addicts, the patient using the drug in his work, like doctors, nurses, and turn on to be addicts. Street addicts, and lastly, neonatal addicts. Neonatal addicts is a child born to an addict mother. To summarize, we throw the light on definition of dependence, criteria of dependence, differences between dependence and habituation, and lastly, different types of addicts. The next, how to diagnose a case of drug dependence or substance use disorder. Like any disease, we can diagnose it by history taking, clinical examination, and investigation. But the difference in drug dependence is the cornerstone in diagnosis is history taking. We take a long history and a detailed history from the patient: personal history, family history, social history, work history, legal history, financial history, and substance of abuse history. Why? Because addiction is a developmental disease. It starts in. This is figure illustrated that the percentage of person using marijuana for the first time, the biggest percent of it in teenager, in the age between 12 and 17. So we need to hear from this patient his history of addiction, his history of drug use disorder, how he started, how he continue, why he want to stop. What is the motive? What is the difference between drug dependence and habituation? Mm, we know there is a big genetic contribution to drug abuse and addiction, and the nature of this contribution is extremely complex. Many researchers found that there is a genetic contribution to drug abuse, and this was why some people become addict and others not. Drug dependence occur due to three elements: genetic element, environmental element, and drug element. Genetic element is a complex element and many researches occur on it. Environmental element meaning the environment surrounding the addicts, a family environment, work environment, his friend, his financial condition, all these conditions can make him addict. And lastly, the drug. Some drug has a powerful addictive property. With small amount, patient turn it on an addict. So we have three elements making person addict. How to diagnose a case of drug dependence or substance use disorder? Like any disease, we can diagnose it by history taking, clinical examination, and investigation. But the difference in drug dependence is the cornerstone in diagnosis is history taking. We take a long history and a detailed history from the patient. Personal history, family history, social history, work history, legal history, financial history, and substance. We can collect the criteria in the following: tolerance, much time to obtaining use and recovering, activities give up or reduce, unable to stop. This is a case of cerebral hemorrhage and due to cocaine dependence. What are the different types of addicts? Therapeutic or iatrogenic addicts, professional addicts, street addicts, and neonatal addicts. What is the difference between these types? Therapeutic or iatrogenic addicts is a patient taking the drug as a therapy and turn on to use it as a drug or substance. Lastly, laboratory investigation. Like any case, we make routine investigation and specific investigation. Routine investigation to evaluate the health condition of the addict, to evaluate the condition of the kidney, the condition of the liver, the condition of the heart, all his organ and system. And specific searching for the drug and its metabolites. So, diagnosis of drug dependence, like any other disease, a puzzle, a puzzle of history taking, physical examination, and laboratory investigation to reach the final diagnosis, But as I told you, the cornerstone in the diagnosis of case of drug dependence is history taking. From history taking, we can know the starting point and reach to the point of quit or stop. Why this patient need to stop? Why this patient want to give up from this drug? Why this patient try to stop using the substance? This is an important point, and I will tell you why this is an important point in the management, in the next point, in the of drug dependence. Management of drug dependence. We must know some points, some important points about the character of drug dependence as a clinical condition or as a medical condition. It is a treatable condition. Okay, it is a treatable condition, but It is a chronic disorder like diabetes, like hypertension. So, short-term treatment is not sufficient. We need long-term treatment program. For the addict, we need long-term treatment program. Also, we facing a monster what is called relapse occurrence similar to those of hypertension and diabetes. So, dependence is a treatable condition, but chronic disorders need long-term treatment, and we facing multiple relapse, and it is a frustrated point, but we must persist to treat this patient. How to diagnose a case of drug dependence or substance use disorder? Like any disease, we can diagnose it by history taking, clinical examination, and investigation. But the difference in drug dependence is the cornerstone in diagnosis is history taking. We take a long history and a detailed history from the patient. First point, we want this patient to stop the use of the drug and return to his family, his work, and his community and become a functioning person. So the goal of our treatment program is abstinence and family work and community functioning person. Okay? To make this, we will put the dependent patient in program. Depend on 3 points. Detoxification process, meaning stoppage of the drug. Stoppage of the drug. On stoppage of the drug, we facing withdrawal manifestation. So be ready to manage this withdrawal symptoms. Be ready to manage these withdrawal symptoms. And lastly, to make this person a functioning person and return to his family and his work, he needs a rehabilitation program. A rehabilitation program. So, in treatment of dependence, we make detoxification, withdrawal management, and lastly, rehabilitation. We need to treat the whole person. We need to treat the whole person through medical services, social services, pharmacological or medication, behavioral therapy, all on the same time. Okay, we start all these points in the same time. This is the drug abuse treatment course component, maybe medical, mental, vocational, educational, legal, human immunodeficiency, viruses, risks, family, child care. All these team work together to make this person from drug dependent patient to drug free patient to normal patient, functioning person in on the society. To summarize, we speak about diagnosis and management of a case of drug dependence. Diagnosis depend on history taking, physical examination, and investigation, but the cornerstone is history taking. Second point, how to manage. How to manage the major goal of our treatment program is stop the drug and return this person to be a functioning person on the society by detoxification, management of the withdrawal symptoms, and lastly, rehabilitation therapy program. Rehabilitation therapy program. In the second part of our lecture today, we will talk more specific about some substance of abuse. We will speak about opioid, alcohol, cannabis, and volatile. We hear about opioid in plant poisoning, but we hear about it as acute toxicity, as a case of acute toxicity. Today we will speak about opioid dependence. It is a chronic toxicity state, but we must know that opioid is a substance with very rapid tolerance. The patient want to increase the amount or decrease the frequency between the amount very rapidly to restore the initial effect of the substance. The dose may be 50-fold higher than therapeutic to be addict over this substance. Also, there is a cross tolerance between all types of opioids as they act on the same receptors acting on delta, kappa, and mu receptors. Okay? First point, we want this patient to stop the use of the drug and return to his family, his work, and his community and become a functioning person. So the goal of our treatment program is abstinence and family work and community functioning person. Okay? Withdrawal symptoms. These withdrawal symptoms ranging from grade 1 to grade 4. Ranging from grade 1 to grade 4. Grade 1 is starting from craving for the drug. There is a sensation of craving to the drug. He is seeking for the drug everywhere and by every method he can reach it by his hand. Grade 2, there is increase in all secretions of the patient. The patient suffering from running nose, suffering from lacrimation, suffering from diarrhea, suffering from sweating, all types of secretion increase. In grade 3, the patient suffering from mydriasis and muscle twitches. And lastly, in grade 4, he suffering from insomnia, increase in vital data, and GIT upset. So, independent, we see four changes: moral, mental, mood, and physical effect. And in withdrawal, we see four grades from grade 1 to grade 4. Treatment of the case of opioid dependence. To manage any case of substance dependence, we must first stop the drug, make detoxification. And to make this detoxification, we can put the patient in one of the three detoxification plans or withdrawal plan. First plan is gradual withdrawal with substitutional therapy. Second plan is abrupt withdrawal. And lastly, rapid withdrawal. What is the differences between these plans in generally? First, gradual withdrawal with substitutional therapy. This plan is indicated for debilitated long-term addicts. Okay? This plan takes from 1 to 3 months. We start to gradually reduce of the dose the patient take it until reach 10 milligram subcutaneous daily, and this continued for 3 days. Okay, we give the patient the dose he usually take it, but reduce this dose gradually until we reach 10 milligram subcutaneous daily, and continue this 10 milligram for 3 days. Then this milligram for morphine or opioid substance is substituted by one first first of all alpha 2 adrenergic agonist or clonidine. Clonidine release endogenous opioid that cause receptor stimulation, subsequently decrease all withdrawal manifestation. But this drug carry the risk of hypertension and sedative adverse effects. So give it with caution, especially if patient suffering from hypotension or other sedative or taking other sedative drugs. Second drugs may be methadone. Methadone is an opioid agonist but has little addictive properties, so can withdraw it from the body without facing severe withdrawal symptoms. Okay, yeah, he gives the patient the sensation of taking opioid but with little withdrawal substance. And lastly, Suboxone. Suboxone is partial agonist antagonist. It can reduce withdrawal and also reduce craving, similar to opioid antagonist. Second type of withdrawal or detoxification is abrupt withdrawal. This preferred in healthy addicts with short-term dependence. This is a sudden stop of the drug without any substitutional therapy. Not stop the drug gradually, but stop it once. When the patient enters to your clinic or your hospital, you should stop the drug. So, it is preferred in healthy addicts with short-term dependence. Also, must do this type under a cover of heavy sedation or may be put under light anesthesia. The patient may be cured within 1 week. So, we discuss gradual withdrawal with substitutional therapy, abrupt withdrawal, and the last type of withdrawal, rapid withdrawal. It is a line of choice, except in cardiac and pulmonary disease. It is similar to the gradual withdrawal, but takes only about 3 weeks. Gradual withdrawal takes from 1 month to 3 months. Here we stop the drug in 3 weeks, in only 3 weeks. But we can do that in cardiac and pulmonary patients. Second point of treatment is symptomatic treatment or treatment of the withdrawal symptoms which appear during the management or during detoxification. We manage these withdrawal symptoms by fluids and electrolytes for diarrhea and sweating or increased secretions as in grade 2, massage for muscular pain, and balanced nutritional diet, vitamins and tonics. Third point is a rehabilitation, social and psychological rehabilitation. In opioid, we can give the person long-term therapy. This long-term therapy in the form of naltrexone. Naltrexone is a long-acting antagonist, giving as an outpatient treatment. The dose of naltrexone is 25 to 100 milligram orally divided per day for 3 months. So, if the addict returns back to opioid, it will have no effect as antagonists block all the receptors. Sorry. We finished opioid dependence. We speak about general character of opioid, clinical manifestation of opioid dependence, clinical manifestation of withdrawal, And lastly, how to manage a case of opioid dependence. Type is cannabis. The second substance is cannabis. Cannabis, the active principle is tetrahydrocannabinoid. This tetrahydrocannabinoid takes only few minutes to get to the brain when we smoke marijuana. Eating takes longer to get to brain, passes through digestive system first. In the brain, it activates the receptors, gives you the feelings of being high. Okay, this is the picture of cannabis plant as we see it in plant poison. Cannabis dependence or picture of cannabis dependence is impaired of short-term memory, impaired of immunity, and impaired of fine movement. The dependent patient suffering from impaired short-term memory, impaired immunity, and impaired fine movement. When the patient starts to stop cannabis, he will suffer from withdrawal symptoms in the form of insomnia, irritability, restlessness, tremors, nausea, diarrhea, loss of appetite, and sweating. These withdrawal symptoms consider a mild symptom, so the patient not suffer like in opioid dependence. So, in management, first point, we want this patient to stop the use of the drug and return to his family, his work, and his community and become a functioning person. So the goal of our treatment program is abstinence and family work and community functioning person. Okay? The third substance today is alcohol. Okay? Generally, we know about alcohol from volatile. Okay? Today we will speak about alcohol as chronic toxicity, not acute toxicity. Alcohol goes directly from your digestive system into your blood and within minutes spreads to entire body including the brain. Brain gets the highest concentration because it gets more blood than any other part of the body. Why? More blood equals more alcohol. So intoxication starts in the brain. Intoxication starts in the brain. Okay? Type is cannabis. The second substance is cannabis. Cannabis, the active principle is tetrahydrocannabinoid. This tetrahydrocannabinoid takes only few minutes to get to the brain when we smoke marijuana. Eating takes longer to get to brain, passes through digestive system first. In the brain, it activates the receptors, gives you the feelings of being high. Okay, this is the picture of cannabis plant as we see it in plant poison. To summarize, we speak about diagnosis and management of a case of drug dependence. Diagnosis depend on history taking, physical examination, and investigation, but the cornerstone is history taking. Second point, how to manage. How to manage the major goal of our treatment program is stop the drug and what is the symptoms of alcohol withdrawal? Alcohol withdrawal pass in three stages. In stage 1, the patient suffers from restlessness, anxiety, sleeping problem, agitation, and tremors. In stage 2, the patient suffering from visual or auditory hallucination, whole body tremors, the pulse of the patient may exceeding 100 beat per minute, the blood pressure may exceeding 100, and there is sweating and vomiting. Sweating and vomiting. Last stage is an emergent stage. The patient suffered from what is called delirium turbulence. He is unoriented of time, place, and person. He has global confusion and inability to recognize familiar object or person, and its temperature may exceed 37.8 degrees centigrade. And this is an emergent condition. An emergent condition. The person is unaware of himself, unaware of the time, unaware of the person and the place. Okay? To manage a case of alcohol dependence, the patient must be hospitalized as we are facing severe withdrawal symptoms. Okay? We use in alcohol the program of abrupt withdrawal, and this abrupt withdrawal is doing under benzodiazepine covering, under sedative covering, good nutrition and vitamin B, and using an antabuse. What is antabuse? Antabuse is a drug blocks the aldehyde dehydrogenase enzyme, leading to accumulation of acetaldehyde. When the patient ingests alcohol, severe but harmless reaction in the form of malaise, nausea, vomiting, palpitation, sweating, and tachycardia. Antabuse must be started 24 hours after the last alcohol dose, and the patient should be on benzodiazepine sedation. Okay, so the patient on the hospital with abrupt withdrawal and giving him antabuse with good nutrition and psychotherapy and group therapy. Rehabilitation program. Enter in the rehabilitation program. Last type or last substance we discussed today is volatile abuse. Volatile abuse attracts younger children or adults who can offer alcohol or street drugs. Poverty, history of child abuse, poor grades, and dropping out of school are associated with inhalant abuse. Some person choose to sniffing, smelling, and inhalation through the nose volatile to reach the narcotic state. They may sniff organic solvents as chloroform, acetone, thinner, ether, and benzene. They also may sniff glue, nail polish for the volatile organic solvent they contain. Of this lecture, we are able to define physical dependence, know the criteria of drug dependence, the difference between drug dependence and habituation, types of addicts, how to diagnose a case of drug dependence, main lines of treatment of an addict, and lastly, we will take a look about common drugs of abuse. bone marrow depression leading to anemia, leukopenia, thrombocytopenia, especially with benzene and toluene, verticular arrhythmia, renal and hepatic damage, dermatitis and inflammation of the nose and upper lip, nasal mucosa is ulcerated and inflamed, and lastly, chronic inflammation of the respiratory tract. So, the target of volatile is the respiratory system. Respiratory system, nerves, and bone marrow. He affects peripheral nerve, autonomic nerve, and even central nerve. Okay? So, today we discuss opioid dependence, discuss cannabis dependence, alcohol dependence, and volatile abuse. We know we today we speak about each of them with detail of pictures of dependence, picture of withdrawal, and how to manage it each case. And lastly, thank you for listening to my lecture. I hope
First,
it is an interesting and you can understand